Coming up next, you want to get rid of that excess fat? Well, how about surgery? We're talking liposuction here. We're talking some pain. Let's see what it really works as. We will show you in these exclusive pictures.
And now, 7 Healthcast with Marilyn Mitchell.
Since plastic surgeons began doing liposuction about a decade ago, it has become the most common of all cosmetic surgeries. In addition, it is now easier and safer. Some of us will do anything in pursuit of the perfect body. When it doesn't come through diet and exercise, some turn to plastic surgery.
I do work out a lot and I try to stay in good shape, but I always had these little problem areas that I couldn't get rid of through diet and exercise.
That's why 30-year-old Leslie Palmer decided to have liposuction on her inner and outer thighs and her knees. This is the old way it was done. A suction machine vacuumed the fat out with a large tube called a cannula. There was a lot of bleeding, scarring, even some deaths. You had to be put to sleep. The recovery was long and painful. But this is liposuction in the 90s.
What you want is you want to shape what you have. Fat is a very beautiful substance in the right amount.
Liposuction has changed greatly in the past decade. It is much more precise, and the results are much better. Surgeons no longer just suck out the fat, they sculpt the body.
You're hearing everything I'm saying, right?
Absolutely. Ask her if she feels anything.
How are you feeling?
Very good. Liposuction no longer requires general anesthesia, only local anesthesia, and you go home the same day. Doctors now use much smaller cannulas, which minimizes bleeding, tissue damage, and scarring. It also involves injecting large amounts of anesthetic solution into the surgical area, which numbs it and softens the fat, making it easier to remove. Now it is gently suctioned out with a syringe.
The easier you are on the tissues, the easier the tissues are on you. That means less pain, gentler healing, less bruising.
These before and after pictures show how liposuction can dramatically change the contour of the body. Dr. Michael Storch has done hundreds of liposuction procedures over the years. Once a critic, he is now a cheerleader because it is better and safer. Using the new technique, there have been no reported deaths and very few injuries.
The advantages are, number one, an improved result because of better control and more precise control over the areas that are going to be suctioned. And also the fact that it becomes a much safer procedure because you're losing a very minimal amount of blood.
3 months after her 6.5-hour liposuction procedure, Leslie is pleased with her new body. She says it was worth the $8,400.
Well, there's definitely a difference in how I look, but there's also a big difference in how I feel. It's like I just feel more free.
Now, plastic surgeons stress that liposuction is not a weight loss procedure. It must be combined with exercise and healthy eating. And there's some pain after the procedure, so you've really got to want to have this done. And it's expensive, costing anywhere from $1,500 to $10,000 or more, depending on what you have done and who's doing it. That's HealthCast. I'm Marilyn Mitchell, 7 News.